My name is Shalini Chawla. I am consultant obstetrician at UCLH. I'm also the postnatal lead here, and I have an additional responsibility of being the college tutor and look after all the resident doctors in women's health. So I have over 30 years of experience, and I have trained and worked in London mainly in teaching hospitals, St. Thomas's, UCLH, Chelsea, Imperial. Did a bit of training in Oxford as well. I have an interest in high-risk pregnancies and have advanced training in maternal medicine. I also run a birth options clinic at UCLH where we give information to women so that they can make choices about how they'd like to have a baby, which I think is really empowering. Before I embarked on my obs and gynae journey, I trained as a surgeon, which means I'm quite comfortable dealing with surgical complexity and also give nice neat scars. Pregnancy is a journey. It's different to any other medical condition. It's not really a medical condition at all. It's a journey where there'll be lots of physical ups and downs, lots of emotional ups and downs, and I see my role as being there by your side, giving you the expertise and the experience, but also just being there whenever you need it. So I'm the postnatal lead at UCLH and have been so for nearly 10 years now. And I've seen a fair bit of birth trauma. And I think that it's really important to have a good pregnancy journey and someone by your side to help you navigate, because it is the deep unknown. And I see my role as, to use an analogy, I sometimes say, think of picture and a frame. You are the lady in the picture and the frame around it. And I provide the framework with my clinical expertise, my experience, and just, I guess, by being me. I'm a mother of 2 children. I've had a high-risk pregnancy myself. I know the journey. I know it's more than just the physical. And there's a lot of mental, emotional aspects to it. I think Fitzrovia Suite offers you best of both worlds, because you get to have excellent private care in a tertiary centre where you've got the backup of all the multidisciplinary teams that you might need, the intensive care facilities, a fantastic blood bank, the surgical side of things if needed, and neonatal facilities. So it's quite reassuring to be in that environment, and especially if it's a high-risk pregnancy. My ethos is that if you're going down the private care route, then I want to be the obstetrician who's there to support you the whole way through. And I make myself really quite available for that. And I'm very approachable. So I give my phone number. You can WhatsApp me anytime. The other thing I do is I do not restrict antenatal appointments. So if you needed to see me 3 times a week for something else, I'm not going to charge that over and above. I find great comfort myself knowing that my women know that I'm there for them whenever they need it.